Hi, everybody. This is Dr. Beth Kennard from Ohio Reproductive Medicine. Happy holidays. Although I know that sometimes when you're going through infertility, you don't always feel real happy. You know, the holidays are tough because most of our holidays are centered around children, and you know that because you've been dealing with this. And it can be really hard to feel sad and like you're missing something and to feel like you're supposed to be happy all the time. So we got to start by saying, you know what, you don't have to be happy all the time. And what we want to do is try to give you some strategies and some coping methods to try to get through what can be a really difficult time for people who are having infertility. Okay, first, let's talk about holiday parties and gatherings and celebrations. These can be just minefields for people with infertility because you can run into, with apologies to any people named Joe, nosy Uncle Joe, who wants to know why you don't have any kids yet. Or as people get more friendly at parties, they can start asking other kinds of nosy questions about what you are going through. And it's nobody's business but yours. So you're going to need to have some skills or techniques or signals to figure out how you're going to handle these people when you're at an event that you couldn't avoid. But that's the first thing to say. The first thing to say is you don't have to go to everything that you're invited to. And so if you think this is going to be a hard holiday season for you, you should sit down with your partner and you guys should figure out what works best for you. Or in another way, what things do you really think you can't miss or you don't want to miss? And what things do you think maybe, nah, not this year? So make a priority list and decide what makes sense for you to go through and what makes sense for you to skip this year. So the first thing is, don't feel obligated to say yes all the time. And if somebody asks you why you're not coming, you can just say you're busy and leave it at that. Now, there's some things you're probably not going to be able to avoid or feel that you can avoid, or maybe you don't want to avoid. And you know there may be some questions that you don't want to share with a whole group of people. So you need to develop a strategy for handling those questions. And it can be any number of things. I mean, I'm not going to tell you how to tell your relatives to bug off, but there are polite ways to say, well, it's been a really difficult time and I'd rather not talk about it right now. And what's going on with your family? So just change the subject and try to move on. Another thing that will happen to many people is that they will feel like they want to go to family gatherings. And of course, there will be children there. So you're going to have to figure out how you'll prepare for that and be ready for that. And one of the best things to do is to give yourself a break and to give your partner, if you have somebody with you, a signal that means I need a break, help me, or can you come over here and distract this child or this person, or can you help me somehow? So I need a break could mean that you're going to have to excuse yourself and go to the bathroom, or you're going to have to go outside for a walk, or you might even need to leave. And if you can work out a way to extricate yourself with these kinds of friendly reasons, you'll feel more comfortable going if you know you have an exit strategy if you need one. Okay, let's talk about holiday cards. Oh my gosh, these things come in the mail and they've always got pictures of all your friends and their babies and their kids, and it can get really tough. So, you know what? You don't have to open them all right when they arrive. Throw them in a basket somewhere. Throw them in the trash basket if you really want to. But don't torture yourself. Nobody knows when you opened or read their holiday card. So that's the first thing. The second thing is sending your own. Do it, don't do it. That is up to you. Okay, let's also talk about other types of traditions. Again, I think you should feel free to set your own traditions. Go ahead and decorate and feel happy that you are in the life that you have the way it is now. And go ahead and don't do certain things if it's going to make you sad. The whole point is to take care of yourself and to pay attention to how you're feeling and to not feel bad if you change things and make it different than the way things used to be or the way you think they should be, because really should is a terrible word for anybody, let alone an infertility patient. The other thing I'd like you to think about is maybe really changing it up a lot. People don't usually think about, say going on vacation for the holidays, but you could. You could go to the beach. If you're from Ohio, the beach sounds really great in the middle of December. It might not be what you think is normal or maybe what you ever did before, but you could. And there are places you can go where you won't run into children. And sometimes running into children is a real bummer. So, very, very nice, fancy schmancy restaurants don't usually have little kids in them. There are certain types of vacations and cruises and resorts where you can't have kids at all. And feel free to avoid children in that way if that's possible. Now, let's talk about gifts. You might be in a situation where you feel or that you have to, or you might want to buy gifts for your friends' kids or your siblings' kids or your neighbors' kids, whatever. And it can be kind of depressing to go into the store and buy presents. And I know this also happens when you get invited to another baby shower and you don't want to go and you don't want to go in the department store and look at all the cute baby clothes. Well, I'm here to tell you, books are your friend. So you get on the internet, you go over to an online bookstore, you scroll down to a book that you liked when you were a kid and buy it and send it. Books are a very simple, not so triggering thing that you can be looking for, and they're a great gift. There's nothing better to share than a book. So we've already talked about how hard this is, and I want to say that again. This is a time of year where we sort of expect that we should feel happy, and we really don't always feel that way. And that's completely normal. I know a therapist who told me it's like the busiest time of year for mental health professionals because it's distressing and difficult for so many people. And here everybody is walking around pretending like this is just the best time of year. Well, you know what? If you don't feel that it is, you're probably joining a lot of other people, and that is okay. You need to be able to think that you are okay, and you need to do what you need to do to take care of yourself. So just like any other time of the year, I would tell somebody, do whatever will help you relax and feel calm and feel centered and feel in touch. So if you're going to feel grief over what you're going through, let yourself feel it. That's okay. It's a normal thing to feel. And then try to figure out things that you can do that will help you feel better. And that could be anything from going for a walk to meditation to guided readings, prayer for some people. Talk therapy can be very helpful for some people. Any kind of relaxation, whatever works for you, to try to focus yourself, take care of yourself, and be good to yourself because you deserve it. I hope this helps. You need to know that all of us who take care of people who are experiencing infertility think you are some of the strongest and most amazing people that we see. And you are tough and resilient. And the holidays can be a really tough time, but you're going to get through it. And I hope that some of the things I've talked about will help make it just a little bit easier for you. So happy holidays.